A warm welcome to all our viewers, to our series Natural Medicine. Today we are talking about air, about breathing, about oxygen, namely the so-called IHHT, interval hyper-hypoxia therapy. This is a form of treatment that was even awarded the Nobel Prize 2 or 3 years ago. Today we are talking about who might be interested in treating themselves and which patients urgently need it. That's why we have our visit doctor here today. Stay tuned, we'll get started right away. And here we are again, and now I may also show you my guest. There she is again. Welcome, Dr. Petra Wiechel.
Thank you, Alexander.
My pleasure. Let's talk about this IHHT. I think a lot of our viewers have heard about it too. You use that too, and I just want to ask. Which people, which kind of patients should now listen very carefully, to realize that this could also be something for them?
Well, we integrated it into the clinic, because the primary requirement for life is oxygen. And as a biological doctor, one is very interested in first granting that to a cell. So, we've done several shows about the microcirculation. It makes up 77% of the body, and if the microcirculation is not granted, that the cell is supplied with 100% oxygen, then deficits will arise at the cellular level. Therefore, the question of oxygen is elementary. Personally, I have always worked with oxygen since the first hour. We do hematogenous oxidation therapies, ultraviolet irradiation of the blood, and pure oxygen. And that is the basic requirement, because it is the elementary basis. Without oxygen there is no life, and that's it. 3 minutes without breathing, it's over. Irreversible hypoxic damage. That means, for everything that is needed within the framework of a chronicity, there is a need for an improvement in intracellular oxygen delivery. And being honored with this Nobel Prize for this methodology was putting the patient under training. The body always wants stimuli. And athletes used to go to the mountain climate, to force the body even more to have a higher oxygen consumption. And of course you can now cover that with this IHHT training for 40 minutes by repeatedly bringing the body into hypoxia, gently reducing oxygen or setting it to a very high level of hyperoxia. So that this state of stimuli is the real training in this therapy. And all chronic disease processes are integrated. All of them. Whether it is the tumor patient or the rheumatic or the metabolically ill or diabetic. Everything that needs new regeneration first needs a really optimal cellular supply. This is important. All the fatigue syndromes, mitochondriopathies are very important at this moment. The IHHT has also made incredible leaps. All the metabolic things, including diabetes for example, diabetes mellitus, also type 1, type 2.
German health insurances now even pay for long COVID treatments with the IHHT.
For example.
They even saw that.
For example, people who are in an incredible stress and thus also produce a lot of high oxidative stress. To protect oneself also in prophylaxis, to tackle these things much more from the organism. These are all great indications. Rapid weight reduction.
Metabolic regulation.
Exactly, the whole fat metabolism. Wherever there is blood circulation, whether arterial or venous, high blood pressure, exhaustion, strengthening the stress intolerance. These are all indications for IHHT.
If I go to the cells again, just for the viewers to understand again. A cell produces ATP and it needs hydrogen and oxygen to do so. Plus some minerals. Then there is an oxyhydrogen explosion and then these energy molecules called ATP are released. I used to always say in our measurements that I had made earlier, you have to imagine it like a bellows, where I blow very little oxygen into the cell. Or I blow really a lot. It's like a fire. A small fire, then a big fire. This is exactly what the IHHT does. A big fire, large, many ATPs. The oxygen utilization of the cells increases.
Yes, but now there is the question of hypoxia. Sometimes it's about less and sometimes it's about much more. If you are at 2,000 meters or at 3,000 and higher, that means at the moment when oxygen is actually in danger, if not enough oxygen gets to the cell reacts. It's controlled by that HIF-alpha. This transcription factor, they got the Nobel Prize for that, which then regulates a cascade of positive reactions that take place. The vessels open that more oxygen reaches the cell. So-called collateral circuits are opened. The oxygen yield is increased. And that's the benefit of this IHHT, that this lesser stimulus which is there momentarily biochemically stimulates a cascade of different processes or one too many. And then comes this great fire. As a result, the body is constantly being forced into this stimulus at different levels. And it can rely on that. 100%. This happens in an intact organism, that it will strengthen this adaptability many times. And that will benefit it in the next stressful situation. This will benefit it in regulating the next inflammatory process much more quickly. This benefits it when it is physically, mentally tense, that it has far more capacity tomorrow to face this process. This is exciting. That's really exciting, because in the past I've always been able to improve blood circulation, increase oxygen depletion, significantly improve microcirculation, also build collateral circuits. But that's a training now. And that's the interesting thing about it. So now for the entire organism a higher, I think adaptive adaptation and regenerative capacity. Because without this banal basic work, because today people no longer have this. They no longer expose themselves to cold stimuli, they challenge themselves physically less and less. These are all processes that don't exactly make our health stronger. You never have phases where the body, even now in fasting periods, what do you think, what kind of power is mobilized during fasting periods? The body nevertheless has to supply everything in terms of health and physical and mental condition, but at the same time to relieve oneself of the many burdens. And these are all processes that are incredibly stimulated.
I have another very important, interesting aspect. If I have always made measurements about the oxygen utilization and whether they are now in the sugar metabolism or in the fat metabolism, I have seen in seriously ill people that they came to me on an empty stomach in the morning. I measure them and they are 100% in the sugar metabolism. And then I had seen the oxygen utilization, yes, 2% oxygen utilization. And when a top athlete comes to me, they have 8 or 9% oxygen utilization. That means this patient is in a sugar metabolism mode for 24 hours. In cancer patients, which is of course logical, always in the wrong cycle.
Right.
And we got that fixed with IHHT training. Suddenly they had 3 or 4% utilization, came with an empty stomach in the morning and are in the fat metabolism.
Yes, of course.
And suddenly they had the air to run up the stairs, which was completely missing before.
Right.
Well, that's just sad. We're doing the second show today. Earlier we talked about magnesium. Nobody talks about the most important tool. And nobody actually talks about this oxygen therapy. And today we do basic work, the two of us.
Yes, it's nice. But you can't build a house with it until you have the foundation, right?
Yes, but I find it sad in that respect. Thank God you exist and you offer all this. But how many people don't have the chance and opportunity to come to you? How many people do not have a chance to deal with magnesium, zinc, selenium, or with an IHHT treatment? And those are royal tools.
These are really big tools and people should be worth it too, who are in some health situation to actually do these therapies and maybe don't do a lot of other things. But this is incredibly important.
With an IHHT treatment, we actually get people to having much more energy to mobilize their inner healer even more.
Yes, you said that beautifully. You said it beautifully.
Who is interested?
That is the second question.
How many treatments do you think a person like that needs?
You always do a series of 8 to 10. That's important first of all. When you do an IHHT, you have to do a series. You can't think that 3 and 4 is enough. It must be important to you that you do it.
Then of course it's good during your stay in the clinic, then the patient always has something to do during the day.
It is integrated into more. It is very often integrated into a treatment concept. They hardly ever come to only do the IHHT now. But there was an incredible benefit in the overall development, since we also offer this training with IHHT. And that's very exciting for me to watch. If you do HOT, for example, this hematogenous oxidation therapy, UV irradiation of the blood and also give oxygen straight into the blood, and you can see how suddenly those suffering from severe depression blossom and recognize the light again, and the light also returns internally. That's absolutely beautiful.
Oh yes, I can confirm that. I once had a lady here who was depressed and I looked at her. I don't see people who are depressed very often. There was no longer a glow in the eyes, just a look into emptiness. And one IHHT treatment and after that the glow was there. It didn't last very long now, a day or two, but the glow was there. That was impressive.
That is quite impressive.
Many viewers don't even know what we're really talking about. What is that? How would you describe that? Is that a bed they lie in? Do you get a mask? Can you tell me a little, do they have to do anything there or can they sleep?
No, they don't have to do anything. They have a very nice armchair to sit in. They are also very welcome to lie down. They have the oxygen mask on and they also have headphones on, so that they can of course accompany this process in a meditative way and don't deal with 100,000 problems now, but to get involved in this state in a very meditative way. Please relax at the same time. If you get yourself out of the stress and now also quickly run there and do IHHT. The system must already be calmed down. It must also be ready for all of this information and for this training what it does. It takes about 40 minutes and we usually work 2 to 3 times a week.
I also found these headphones that you just mentioned very, very important. I have often seen people at risk of burnout, they could not let go. They sat in the armchair and only through these headphones, where the special music was there, with a hertz difference, the brain had to put this music together. Could they let go? And then we were able to break the rigidity and they actually came down into the regulation, and otherwise they were always up, and they never came down. So that's a great concept too, that's all I can say.
Yes, and regulation again means function tomorrow. And when I say 2 to 3 times a week, then of course that means for people who are there for 3 weeks and those who are only 2 weeks, it means almost daily.
How does it feel when you have the mask on now and now it's going into hypoxia? That means they get less oxygen, so simulated, we put the patient at 5,000 meters now, then the air is thinner. What is happening to them? How does it feel?
How does that feel? So not scary because we don't leave them in this hypoxia for long and we also ask them to breathe calmly and focused. We also ask that you close your eyes. They also have, we forgot, an eye mask so that they adjust properly to this process. And in this breathing rhythm, these are not processes at all that cause them discomfort.
It was actually always like that for me and also for my wife when we got into hypoxia, into this undersupply. We were really in deep meditation. We were just gone. And then if we were lucky enough to get into 75% oxygen saturation, then it was really like a tunnel and a floating state. Like a dream. And then the oxygen comes back and you're back. And that has always been a trigger, also with happiness hormones, feelings of happiness. I have the feeling that you are a completely different person when you swing back up from this wave and have this feeling. And then the next wave comes again.
Yes, it's like when you climb a mountain, then you also have this euphoria and joy. The experience isn't that incredibly long and big for us. We are now talking about a procedure, but I think in half a year we already have a lot, much more to watch. But it's nice, you made it yourself.
Yes, I loved that. We've actually been doing this for a couple of years and now it's coming up more and more and more and I see it spreading, this technology, and it's allowed to work wonders. But I also only see that exceptional physicians like you ultimately integrate such technologies, but I don't see such things standing with a conventional doctor around the corner.
No, it hasn't arrived there yet and the central importance of things is far from being normal. It's more symptomatic that everything is kept lukewarm somewhere. I sometimes get the impression that we're really trying to clarify things. We don't clarify anymore. And that's sad.
Absolutely, absolutely. I also found it sad, especially when on an empty stomach in the morning you measured patients and found out that they are in sugar metabolism and then you ask whether they ate breakfast and they say 3 croissants, as a cancer patient. And then I ask whether the oncologist never said anything that the diet wasn't optimal. And that's exactly where you suddenly find things out when you measure, when you see, hello, what's going on? Why, I didn't eat any sugar, I only ate bread rolls, there's no sugar in them.
Well, and through this fermentation metabolism of the tumor cell, it naturally draws 18 times more sugar to itself and this naturally becomes a dramatic development of a tumor disease steered in the wrong direction. That is Warburg's knowledge from the 1930s. We are in 2020 now, he received the Nobel Prize in the 1960s. We know all this but we negate it in everyday life. That's just incomprehensible.
Yes, I can even top that. The other day someone was there, a diabetic patient, and told me that his family doctor was furious with him, because he suddenly changed his diet in such a way, also through the program DRS Kitchen Talk, whereas a diabetic he cooks differently today, and the doctor was so angry because now of course his settings with injecting insulin are no longer correct. So I thought, that's completely wrong, isn't it? He should say, great, great, now we have to inject less and decrease the dose, but no, he was mad. And I really don't understand that anymore.
Yes, there is also a great need in diabetology. You can have type 2 diabetes, that's insulin resistance diabetes. I will never forget the elderly gentleman. He was 75 and had to inject insulin for 8 or 9 years because the oral medication no longer worked, and through high enzymes, through really also consciously changing a lot that he didn't know, he didn't need any insulin at all. That was over. And this happiness in his life, he had it until the end of his life, he lived this joy. And how much is possible? So we learned as students that people who are insulin resistant are not insulin patients. And these people all run into so many dangers over the long term from this hyperinsulism. Because resistance is a whole different topic. What is the insulin doing that you are injecting with you? And that's sad, I think, that's really sad. But of course you also need the motivated patient. You need someone who takes it into their own hands, who implements it, who becomes active. Those can do a lot, change a lot. Than just believing that I'll take the medication and if it doesn't heal anymore, then I'll have to inject. No, 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 it's not like that at all. At any time of the day, you can change metabolism. And then your system adjusts to it, and then many things become superfluous to believe at the moment. Every third person over 60 already has diabetes.
And how many children at the age of 15, 20 or 12 already have it?
More and more. And of course there are other reasons for that, but we also know them today.
Thank you very much for these explanations. For you, that was Dr. Petra Wiechel. And maybe I just want to add that word has also gotten around about the IHT nowadays at fitness centers where medical work is not done, but at least the metabolism is acted on so that you lose weight much faster. We also accompanied that with a fitness center and saw that between 3 and 7 kilos of weight were lost in a week. That was absolutely normal. That was absolutely average. Of course, the diet has been completely adjusted for this week, but so much is possible when it comes to IHHT. But of course that's one more thing. Of course, if we also use IHHT on patients, then you can just strengthen the inner healer of each patient even more. And ultimately every healing is a self-healing. On that note, good luck. Thanks for watching. See you next time.